Hello friends, welcome back to my YouTube channel. The topic of our today's video is ear infection in kids and what parents need to know about ear infection. An ear infection is an inflammation of the middle ear, usually caused by bacteria, that occurs when fluid builds up behind the eardrum. Anyone can get an ear infection, but children get them more often than the adults. 5 out of 6 children will have at least one ear infection by their third birthday. The scientific name for an ear infection is otitis media. The symptoms of an ear infection usually start quickly and include pain inside the ear, a high temperature, being sick, lack of energy, difficulty in hearing, discharge running out of the ear, a feeling of pressure or fullness inside the ear, itching and irritation in and around the ear, scaly skin in and around the ear. Young children and babies with an ear infection may also rub or pull their ear, not react to some sounds, be irritable or restless, be off their food, keep losing their balance. Most ear infections clear up within 3 days, although sometimes symptoms can last up to a week. If you or your child have a high temperature or don't feel well enough to do your normal activities, try to stay at home and avoid contact with other people until you feel better. Now we will discuss who is at higher risk for ear infections. Children less than 5 years old because they have shorter eustachian tube. Children who attend daycare because they tend to have more colds. Children with allergies. Children who are exposed to cigarette smoke. Smoke causes inflammation of the eustachian tube, making ear infections more likely. Children who were not breastfed. Breast milk has antibodies that helps fight infections. Babies who are being bottle fed, especially if they swallow milk while laying too flat. Milk can enter the eustachian tube and causes inflammation, which increases the risk of an ear infection. Children should be held upright while drinking a bottle. When they are old enough to hold their own bottles well, they should be taught to drink from a regular cup and no longer given a bottle. Children with cleft palates, as their eustachian tubes are often inflamed. Children with Down syndrome. Now the question is, what causes an ear infection? Bacteria and viruses cause ear infection. Often ear infections begin after a cold or another upper respiratory infection. The germs travel into your middle ear through the eustachian tubes. Once inside, the virus or bacteria can cause your eustachian tubes to swell. The swelling can cause the tube to become blocked, leading to poor eustachian tube function and infected fluid in your middle ear. Ear infections are not contagious, but the virus and bacteria causing the infection can be contagious. Multiple types of bacteria and viruses cause ear infections, including ones that causes cold and the flu. Now I will discuss about the complications of ear infections. Most ear infections don't cause long-term issues. When complications happen, they are usually related to repeated or ongoing ear infections. Complications include hearing loss. Temporary hearing loss or changes in your hearing are common during an ear infection. Repeated or ongoing infections or damage to internal structures in your ear can cause more significant hearing loss. Delayed speech and language development. Children need to hear to learn language and develop speech. Hearing loss can significantly delay development. Torn eardrum. About 5% to 10% of children with an ear infection develop a small tear in their eardrum. Often the tear heals on its own. If it doesn't, your child may need surgery. Spread of the infection. Untreated infections or infections that doesn't improve on their own can spread. Infection can spread to the bone behind your ear. Occasionally, an infection can spread to the membranes surrounding your brain and spinal cords and cause meningitis. How is an ear infection treated? If a child doesn't have too much discomfort or a high fever, the doctor will likely wait 24 to 48 hours to see if the ear infection gets better on its own. If the child doesn't improve or gets worse, contact the doctor again. Your child's doctor will prescribe antibiotics if child is moderately to severely ill with high fever. Your child has severe pain. The condition has not improved for 48 hours or the ear canal has new fluid. For an uncomplicated ear infection, children between 6 months and 2 years usually take an antibiotics for 10 days. Children over 2 years of age will take an antibiotics for 5 days as prescribed by the doctor. Your doctor might suggest acetaminophen or ibuprofin to reduce the child's pain. Only give ibuprofin if your child is drinking reasonably well. Don't give ibuprofin to babies under 6 months old without first talking to your doctor. Don't give over-the-counter medications to babies and children under 6 years without first talking to your doctor. The only exceptions are medications used to treat fever, such as ibuprofin and acetaminophen. Children usually feel better within a day of starting an antibiotic, but make sure to finish it. Your doctor might want to see your child again to be sure the infection has cleared up completely. Fluid can remain in the middle ear without inflammation for a few weeks. Thanks for watching my video. For any health related question and query, you can ask in the comment section below. Goodbye.